Hey YouTube, it's Mixie Tarot again. So the other request that I got for a video was why so many people of color are being neglected and dying with COVID-19 due to the neglect from medical staff. As I said in my comments when I got this request, medical neglect when it comes to people of color or minorities or marginalized people, that's not uncommon. The statistics show that I'm African American, so for example, like statistics among African Americans, when a patient goes in and they say, oh, I have this pain and this pain, the doctors tend to brush it off and say you'll be fine. Whereas if someone white goes in and complains about pain, they're taken care of. This is why you have so many people, some, not all doctors are like that, because I had something personal like that happen to me. I went to a doctor in Beverly Hills. He referred me to a different physician who he thought would be better, and it happened to be in at a location where there were more minorities, more elderly, and some people seemed like they may be considered to be in the poverty line. So that being said, that was an eye opener for me. It showed me, it spoke volumes. It showed me exactly what this doctor was thinking. Of course, it was a white doctor, very young and also arrogant. And I guess he just felt like I was in the wrong place. Anyhow, so it does happen even before COVID-19. Statistics show that people of color or marginalized people actually get less attention than white patients. That being said, I'm going to attempt to read on it. So I'm going to start with the next World Tarot. Angels, why are so many people of color or marginalized people dying from COVID-19 due to neglect? I'm hearing it's exactly that. It's just neglect. Why are so many people of people of color or marginalized people dying from COVID-19 due to medical neglect? So we have the King of Cups, the throne of movement, because it's been brought to people's attention. It's something that is going to change. It's going to move along slowly, but it is something that's going to change. We've got the King of Wands, the throne of fire, because doctors, nurses take an oath to protect all life. This is definitely something that's going to come up in conferences that they have. Some of them may not even realize that they're doing it. The Six of Cups, reunion. The Six of Cups. I think they're going to focus in with this card. I think they're going to focus in on the elderly and the youth, the young children who are African American specifically. I'm getting from this card, but their biggest concern is the elderly and young children. Yeah. The Six of Pentacles, redistribution. Um, this is just going back to the drawing board and seeing where, looking at reports and seeing where these incidents are being recorded and revamping the system, the medical system, or revamping the facility where these incidents are happening the most. The Seven of Swords, we have escape. Seven of Swords, escape. I'm not sure about that one. Revolution. With this, I'm just getting that, see, it says defend the sacred, no blood. This is just making sure that people, no matter who you are, you get the same fair medical advice and treatment that anyone would. The Queen of Wands, the Throne of Determination. I'm just hearing that this is going to be made a priority. That this is something that they are truly, they're not just saying that they're going to look at this and try to make things better. They're not just saying it, they are going to do it. The Three of Cups, joy. Joy. I'm not sure about this one. The next card we have out is the Messenger. So I wouldn't be surprised if this is something that's going to be discussed amongst representatives and trying these representatives going back into their communities and trying to find out from the citizens what's happening, if they're seeing anything, if they've experienced anything, that sort of thing. And then trying to figure out a way to make things better, that everyone's getting fair treatment when it comes to medical. The Three of Pentacles, again, the team working together to try to figure out a way to remedy this. The Star, and they for the most part will be successful in making things better in the medical field. Like I said, they went into they became doctors so that they could help people. And for most doctors, that is what they want to do. And not all doctors are the same. That goes both sides. There are some doctors who really are trying to do the right thing and make sure all of their patients are treated fairly. There's some doctors who are just in it for money and will try to hustle you any way they can. And then there are some doctors who just, maybe some of them don't even realize it, some of them probably do, that they don't treat all of their patients the same. And then we have the Four of Swords, respite, taking the time to really analyze and look at all of the information that was gathered and making the best decision to make things better, and then putting it to rest, but always keeping an eye on it. Yeah. The methodical approach, the Knight of Pentacles, just looking at the facts and the data to see where they can make improvements. The King of Swords, the Throne of Knowledge, the Throne of Knowledge. Again, gathering the data and making the best decisions. The Eight of Pentacles, creation. For me, again, this is all of the data, and then pulling together a team that can analyze that and make the best decisions for these disparages. And the Knight of Swords, the escape plan. Yeah, the plan to make things better. It's not necessarily saying why these doctors are doing what they're doing or why the nurses are doing what they're doing, but it has brought it to light that it's happening, and it is something that they're going to work on, that they're going to try to make better. Any mixed emotions? Any mixed emotions? Any mixed emotions? Yeah, they're receptive and open to constructive criticism. They want to make things better. They do acknowledge the sadness that they see in these disparages. They're ashamed of what's happening with COVID-19 and patients of color. They simply want peace, the calm, the serene, and centered. They want things to be balanced between all patients. And they're confident that they can achieve this by looking at the data and the cases that have been brought to their attention, as well as cases that have happened before COVID-19, where patients were treated differently just because of the color of their skin, or they were poor and they just didn't have the money to pay. They're looking at all of that. So that's what I'm seeing as far as that goes. I think I'm going to end the read there. Maxie Tarot out.